Most people think the knee works like a door hinge. It bends, it straightens, and that is basically the whole story. But the knee has a small hidden twist built into the final part of straightening. In the last degrees of extension, the shin bone and thigh bone rotate slightly relative to each other. This is called the screw-home mechanism, and it is one reason the knee can feel stable when you stand tall. Before we start, this video is for general education only. It is not medical advice, and it cannot diagnose knee pain, instability, or injury. If you have symptoms, a clinician can evaluate your specific situation. The knee is often described as a hinge joint because its biggest movement is flexion and extension. Flexion is bending, extension is straightening. But inside the joint, the surfaces do not move like a perfect metal hinge. The femur has rounded condyles, the tibia has a plateau, and the two surfaces roll, glide, and rotate as the knee moves. That little bit of rotation is not a mistake. It is part of the design. Here is the key shape difference. The inside condyle of the femur, called the medial femoral condyle, has a longer articular path than the outside condyle. As the knee approaches full extension, the two sides do not finish their glide at exactly the same time. The longer path on the medial side encourages a small rotation between the tibia and femur. In an open chain movement, like sitting and kicking your lower leg forward, the tibia tends to rotate externally near the end of extension. In a closed chain movement, like standing up from a squat where the foot is planted, the femur rotates internally over the tibia. That difference matters. When your foot is free in the air, the shin bone is the moving bone. When your foot is planted on the ground, the shin is mostly fixed, so the thigh bone has to rotate instead. Same basic joint event, different moving bone. This is why biomechanics can sound confusing at first. The language changes depending on which bone is moving. As the knee reaches terminal extension, the cruciate and collateral ligaments become more tensioned. Think of them like stabilizing straps. When the joint rotates into its locked position, those straps become firmer and the knee becomes more mechanically stable for standing. This does not mean the knee is literally locked forever. It means the joint settles into a close-packed position where less muscular effort is needed to hold the leg straight. That is useful because humans stand a lot. If your knees had to rely on constant, strong muscle contraction just to stay straight, standing would be exhausting. The screw-home mechanism helps the skeleton and ligaments share the job. It is one of those small mechanical tricks that makes upright posture more efficient. But if the knee locks into extension, how does it unlock to bend again? One important player is a small muscle behind the knee called the popliteus. It has a diagonal line of pull that helps reverse the rotation. In an open chain movement, it can help internally rotate the tibia. In a closed chain movement, it can help rotate the femur. Either way, the idea is simple. Before the knee bends smoothly, it has to untwist from that stable end position.
A good analogy is a jar lid. You cannot lift the lid straight up until you first twist it open. The knee is not a jar, of course, but the sequence is similar. Near full extension, the joint has a tiny rotational close. Before flexion, it needs a tiny rotational open. You can see why this matters during walking. As the leg swings forward, the knee extends before the foot meets the ground. That extension is not just the leg getting longer, it is also the joint preparing for contact and stability. When the foot hits the ground and your body weight moves over it, the knee needs to be stable enough to accept load, but mobile enough to bend again as the step continues. The same concept shows up in exercise. At the top of a squat, the knee approaches extension while the foot is planted. The femur rotates over the tibia. During a seated knee extension machine, the tibia rotates under the femur. During walking, the exact pattern changes through the gait cycle. The knee is not doing one simple hinge motion in every situation. It is adapting based on load, foot contact, and which bone is free to move. This is also why we should be careful about turning anatomy into one-size-fits-all advice. The screw-home mechanism explains a normal joint motion. It does not automatically explain every knee click, every pain pattern, or every injury. Knee symptoms can involve cartilage, ligaments, tendons, nerves, inflammation, previous injury, and many other factors. This video is about the mechanism, not a prescription. So let's recap. First, the knee bends and straightens, but it is not a perfect hinge. Second, the shape of the femoral condyles creates a small rotation near the end of extension. Third, in open chain movement, the tibia tends to externally rotate. In closed chain movement, the femur rotates over the fixed tibia. Fourth, this motion helps the knee become more stable in full extension. And fifth, the popliteus helps begin the unlocking process so the knee can bend again. The hidden twist of the knee is small, but it is one of the reasons walking, standing, and squatting are so mechanically elegant. The next time you straighten your leg, remember, your knee is not just closing like a hinge, it is quietly screwing itself home. If this helped you see the body in a new way, subscribe for more calm 3D anatomy explainers on movement, joints, organs, and the mechanics that keep us alive and moving.
Before we wrap up, let's replay the knee lock in slow motion as if the bones were transparent. As the knee moves from a bent position towards straight, the tibia rolls and glides against the femur. Near the end of extension, the joint does not simply stop like a hinge on a door. It adds a small rotation that helps the contact surfaces line up and makes the leg feel stable when you stand. In a 3D view, this is easiest to understand by watching three things at the same time. First, look at the rounded femoral condyles at the bottom of the thigh bone. Second, watch the flatter top of the tibia underneath. Third, notice the ligaments crossing around the joint. The shape of the bones and the tension in the ligaments guide the final twist together.